The assessment of Nigeria's health facility with the Medical Laboratory Science Council of Nigeria (MLSCN) is to ascertain if Nigeria has the capacity within the African region to provide biosafety and biosecurity training and testing. The assessment was carried out by a team of scientists from the Africa Center for Disease Control. The team had a pre-assessment meeting with the leadership of MLSCN, led by the Registrar and CEO, Dr. Tosan Erhabor, as well as with the Minister of State for Health, Dr. Joseph Ekumankana. Both the Registrar of MLSCN and the Minister of State for Health assured that Nigeria can provide the much-needed medical laboratory services in the West African region.
Well, when you talk about in terms of structural development, you can see that he has expanded the buildings that have accommodated more labs, new labs, and they have given, created new space for staff of the council to work in a conducive environment. You can also, you've noticed that the assessors from African CDC are here, and they are here to come and assess the new labs that they've established that will be able to accredit them as a center of excellence, where accreditation and assessments will be done for some of our experts that travel all the way to Australia and Japan to get accredited. But with the accreditation they are going to have today, because it's after the assessment by the assessors from African Center for Disease Control, you find out that it is an upgrade.
Assessors from African CDC, who has come to assess facility of Medical Lab Science Council of Nigeria as a center of excellence as it relates to biosafety and biosecurity in West African region. After this assessment, MLSCN will now be the only facility in West Africa to take charge of training and building of capacity of biosafety and biorisk activity in West African sub-region.
The leader of the team expressed optimism that Nigeria will meet the criteria.
Was adequately described, and its goal is really to work with member states to build your capacity so that you can be able to implement some of the global treaties, the regulations, the policies that we have already signed to. For example, your international health regulations, the biological weapons conventions, global security agenda. We've signed and attested to these global treaties, regulations, and policies. But when it comes to implementation on the ground, there are issues related to our capacity. So in order to assist member states, Africa CDC is now working with member states in that biosafety and biosecurity initiative.
The advent of COVID-19 has made Nigeria to strengthen its laboratory capacity nationwide. Thus, the country was selected for Laboratory Reference Point accreditation by the Africa CDC. Joseph Kadri, ATV News.